afternoon, everyone. On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to another episode of Breast Cancer Awareness Series, which has been supported by Roche. According to World Health Organization, in 2020, more than 2 million women were diagnosed with breast cancer, and nearly 0.7 million deaths were reported globally owing to breast cancer. Breast cancer has now surpassed even lung cancer as the leading cause of global cancer incidence in 2020, with an estimated 2.3 million deaths and new cases. So, to create public awareness on the different aspects of breast cancer, we have organized these spotlight sessions wherein our experts will share relevant knowledge and educate people about breast cancer, along with shedding light on the various facets of the disease. In today's session, we will be discussing about the importance of early detection of breast. To discuss about this very pertinent issue, we have with us Dr. Ma, who's the lead oncologist and medical director of Sparsh Hospital, Bengaluru. On behalf of Dr. Mansi, I welcome you to the talk session.
Thank you. It's a pleasure to be part of this. Take it forward.
Thanks for being with us. So, we'll think, how common is breast cancer in India? Like, what is the present?
So, initially, long time, cervical cancer, the cancer of the cervix was the commonest cancer. But now, breast cancer is the commonest cancer among women, with an alarming rise, especially over the last 2 decades. So it's estimated that 1 in 28 women in India is likely to develop breast cancer during her lifetime. Now, this figure globally is 1 in 8 women. So in the Western world, 1 in 8 women is likely to develop breast cancer. In India, it is slowly picking up. The average is 1 in 28 women. But if you split it into rural and urban areas, urban women are at much higher risk of breast cancer. So 1 in 22 women in urban areas is likely to develop breast cancer. And this figure is in the rural areas. So you can see that modern lifestyle or urbanization is possibly linked to breast cancer very, very seriously. So the increasing trend is believed to be influenced by lifestyle changes. We see that the children these days attain menarche, the age at which they start having periods has kind of decreased. So earlier we would see menarche in 14, 15 years of age. Now it is 11, 10, 12, in that range. So early menarche is linked along with this higher risk and higher incidence. Along with that, modern lifestyle where women are opting for no pregnancies or late pregnancies, or even with after pregnancies, the lactation or the time when they breastfeed the baby is reduced, or they don't breastfeed. So factors like breastfeeding over 1 year is associated with a protective effect for breast cancer. Also, smoking and alcohol are significantly responsible for the rise in breast cancer. So modern lifestyle is coming with an increased risk of breast cancer, I would say.
Right, Dr. Mansi, very rightly have pointed out how modern lifestyle is one of the major, allegedly one of the major factor for this rise in numbers. Coming to, because we are discussing about early detection, regular breast self-exam is one of the most important step in that direction. So how often should women perform them? Why are they important? What are some of the, changes that they should be looking for when doing that?
So a breast self-examination is a technique which helps in, familiarizing a woman with her own breasts. So every woman should know how her breast feels normally, so that she is the first one to detect when there is something abnormal in her own breast. It helps in identifying any unusual changes very early on. So, breast self examination is not a substitute for routine screening or regular examinations, but it definitely complements, especially because mammography, which is the routine screening, we usually recommend above the age of 50 years. And we are seeing that breast cancers are also happening in the age of 40s and even 30s. In fact, it's very common now in India to have breast cancer diagnosed at an early age in the 30s and 40s, which is a decade earlier than the Western world. So in these women, when you are not going to go for the routine planned mammography, something abnormal felt by the person herself is going to make her seek medical attention at the earliest. So I would say that every woman should perform, at least starting from the age of 20, should perform a breast self examination every month, preferably 3 to 4 days after the onset of her periods, and approximately the same date every month or the same day of her menstrual cycle, because early on, just after the periods, the breasts are softer and less tender. So at the same cycle, same day of the cycle, the breasts will should feel same in every cycle. So I would say fourth or fifth day of the period, if a woman does every cycle, that would be an ideal, time to do breast self examination. There are various YouTube videos available on how a breast self examination should be done. It should be done in front of the mirror as well as lying down, and it can also be done in the shower. So I recommend every woman to go through these YouTube links or videos, which takes about 1 to 2 minutes every month for your own breast health. And it's not much to ask for. It's something very basic, and every woman should be doing it. And I would say start it as early as possible. Start it in your 20s. If anything abnormal is felt, it could be either in the shape or size or color of the breast or the nipple. It could be a small lump felt. You just seek medical attention very soon. There is obviously there will be some more tests which will be advised by the doctors just to rule out breast cancer. A lot of times these could be benign tumors or benign findings, but it's always better to be sure, especially when we are seeing so many breast cancers in younger women. So definitely breast self examination, I highly recommend it. Of course, it should be complemented at the right age with routine screening and clinical examination by a doctor as well.
Right, Dr. Mansi. That was very helpful information. Like you talked about how there is a lot of stuff on social media, YouTube videos where women can go and check out how to, go about that. Now, like you said that, but then routine checkups have to be there. They are no substitute for those checkups. Coming to the first thing, when we think of early diagnosis, mammograms is the first step that and in India especially there are a lot of myths related to that, what it is and why it's important, an important screening tool for breast cancer.
So a mammogram is nothing but an X-ray of the breast. So just like you do an X-ray of the chest, I think most of us would have done it at some point of time. It is an X-ray of the breast, but because breast is a dense tissue and it has a lot of fat and glandular structures, it can't be done as easily as a chest X-ray is done. So in mammogram, what they do is there is some compression of the breast, which may cause a bit of discomfort, but it is just a basic X-ray. A temporary discomfort may be experienced while a woman is undergoing mammogram for maybe a couple of hours or a couple of days maximum. But it is very important that a clear image of a mammogram is produced, which is done in a proper way of compression of breasts. And this clear image will help us in picking up anything that is very tiny, not even felt or palpable on your breast self-examination. So a mammogram is an X-ray of the breast, which should be done by every woman as a screening strategy. it should ideally start at least at the age of 50 years. In many countries, it's done after 55, but I would say 50 should be the time when we should start in India. It is recommended once a year or at least once in 2 years. Now, screening with mammogram is a part of regular, health uh, checkups or everything in other countries where it is sponsored by the state or the insurance. In India, we do not have a national screening program, so it takes a lot of effort and initiative on the person's side. So you have to yourself take the initiative and get the screening of the mammogram done. And this is done so that if there is any small lesion or some abnormality that is seen in the mammogram, it will immediately be addressed, and based on the findings of that, you will be advised whether you can just ignore it or you should go for any further testing to pick up a cancer early. And if something is picked up on a mammogram, it's usually an early stage cancer. And the earlier you pick up a cancer, the better are the cure rates. In fact, early detection these days is equal to cure in breast cancer, because the cure rates in first stage of breast cancer are 95% and above. So I would recommend a mammogram for every woman. After the age of 50, if there is a family history, then 10 years before the age of your family member who got breast cancer, start a mammogram, X-ray mammogram to be done. If there is anything abnormal felt, there might be a need for an ultrasound or an MRI of the breast. It will be advised by the doctor, but as an individual, a person should opt for X-ray mammogram.
Right, Dr. Mansi, that indeed was a very relevant information, that how to go about it, and how mammograms, because in India there are a lot of confusions, and especially when it comes to breast health, there is a lot of taboo and stigma. Women do not seek medical intervention, and they try to just ward it off for as long as possible. So there are a lot of myths related with mammograms. And apart from mammograms, when we talk about other diagnostic methods, which are imperative, what are some of them?
So, see, the basic test is mammogram. It gives you a visual picture of the breast. Now, a visual picture can only give you so much information that it looks like a high risk lesion in the breast. To confirm that, you need a test where you actually address that lesion, or you take a small piece out of that lump or lesion that is seen in the mammogram and see it under the microscope. So we call it as a biopsy. If something abnormal is felt or seen in the mammogram, you may cross validate it with something called as ultrasound of the breast, and even MRI of the breast in women who have very dense breasts. But ultimately, if there is suspicion of breast cancer, it can only be confirmed with the help of a biopsy. So, biopsy is a small needle test where a needle is inserted where there is a small lesion seen on the mammogram and a small piece of breast is taken. It is absolutely painless. It can be done under local anesthesia. It is an OPD procedure. A lot of people even do FNAC, which is similar to biopsy, but instead of a small piece, a very small fluid-like material is taken out from the lesion. I would recommend everybody, if an FNAC is advised, I would recommend better go for a biopsy. It gives you a much more valid information. And if any further tests are needed, if a cancer is confirmed, also breast biopsy would be the ideal test. So breast self-examination, something suspicious feel, you do a mammogram. If something suspicious which has a high risk of being a cancer is feel, then you do a biopsy. These are the three main tests which will confirm whether there is breast cancer or not in the diagnosis.
Right. And like you've already told that, breast self-examination should be, conducted once in every month. Right. And what about mammograms? How often, like once in a year, or what should be the frequency?
So, as I said earlier, start it at age of 50 years or 10 years before the onset of breast cancer in your family member. If there is a family history of breast cancer, start it at that age. And then ideally, in some countries, it's once a year. In some countries, it is recommended once in 2 years. So I usually give that leverage to patients that you do it ideally once a year. But if you can't do once a year, at least once in 2 years, a mammogram should be done starting from the age of 50 years to say about 70, 75 years. There is noted benefit in doing this mammogram. Of course, a lot of people say that there is a risk of radiation exposure, so we shouldn't be doing it. But the mammograms these days are very high definition, and the quality is very good. So the radiation exposure, which is very less, gives a very clear image. And if you actually go to see, if you do a mammogram for 10 years or 15 years also, you would still be getting less radiation exposure than a single CT scan. So the risk is not as high as it is perceived to be. Sometimes mammograms may give a little bit of false positive information where you might get panicked about something. After the mammogram, a biopsy is done. A biopsy will show there is no cancer. So a lot of people might think it is a burden, or it is over diagnosing or over testing. But if it turns out to be negative, it should be something to be relieved about and not to be hassled about. Of course, there is a lot of anxiety which is added because of a false positive test. But if it picks up cancer early, there is, it is priceless. So I would say women don't get bogged down by these myths of radiation exposure or the fear of extra tests being ordered. Just get a mammogram done once every year, or at least once every 2 years, starting from the age of 50. If you are younger than 50, at least start doing breast self-examination once every month. That should be a good strategy to begin.
Right, very rightly pointed out. At least, once a month you can do a self breast examination. But what about other early signs and symptoms? Apart from self breast examination, what are the other signs and symptoms? Physical signs, telltales that can, detect breast cancer early.
Yeah. So first thing is, on examination, you will feel a lump, but sometimes there might be no lump felt, or the lump may be very deep. So besides a lump, there are many other signs which a woman should be vigilant about. There could be some unexplained pain, though usually cancer is not very painful, but sometimes when there is some inflammation along with that, it could be painful. So there could be pain or discomfort in the breast or the armpits. The first place where cancer spreads from the breast is into the armpits. So even examining armpits is very important. So it could come as a lump or discomfort or irregular. You might not feel like it is a lump, but there could be irregular thickening or irregular nodularity that you feel over the breast. There could be a change in the size and shape of the breast. There could be change in the size or shape of the nipple. There could be nipple discharge or eversion of the nipple or inversion of the nipple, or there could be change in the nipple position. That could be change in the skin over the breast. It could be puckered, or there could be dimpling. There could be rashes on the skin. There could be change in the temperature of the breast, or there could be redness around the breast. And any of these changes, when they are lasting for longer than 3 to 5 days, you should bring it to the doctor's attention. So that would be very important, that how your breasts look like, and anything abnormal that you see, just go and meet the doctor. There is a lot of stigma in getting yourselves examined, or women don't even report it to their own family members if something is there in their breast, which is the reason our breast cancers in India are diagnosed at a very late stage, whereas it can be diagnosed at an early stage. So I would say that anything abnormal, at least if you have some stigma, at least go and see a female doctor. If you cannot make yourself feel comfortable about a male doctor examining your breast, but please show to a doctor if you feel or see anything abnormal over your breast. Even if it is something very simple, don't have that fear that, oh, somebody will think I'm stupid, or I'm panicking, or I'm being a very anxious person. It's okay. Getting yourself checked is always better than not getting yourself checked. So I would recommend seek medical attention whenever anything abnormal is felt or seen over the breast.
Right, Dr. Mansi. So you've already talked about, how breast health is stigmatized and there's a taboo surrounding it. Women don't openly talk about it. So how can awareness creation, work in that arena? Because when we openly talk about it, we create that level of awareness where women are feeling, uh, coming out and talking about it, they are comfortable in doing that. You think awareness does create that kind of an impact?
Definitely. So, the entire month of October, where we talk about breast cancer awareness, I see a significant rise in awareness, and where women are taking their own health in their own hands after these kind of campaigns, when they are being made aware about what are the risks and why should these taboos or myths not really bog them down. Earlier, people also had this fear that, oh, even if it turns out to be cancer, I won't live for long. Why do everything? But with better treatment outcomes, with newer treatment strategies, we are seeing women live for even 5 to 10 years, even in the last stage of breast cancer. And when you are aware and you get yourself detected early, say stage 1 or stage 2 of breast cancer, I think every woman has a normal life ahead of her if the treatment is sought at the right time. So even breaking those myths and fears about the treatment of cancer is also helping in women being more aware and more vigilant and wanting to get detected early. If at all they do have cancer, why not get it detected early and get it cured completely? It's very much possible in today's age, unlike say 30, 40 years ago. So awareness goes a long way. We have a lot of patients, and even we have a lot of celebrities who have survived breast cancer. They are doing their bit to spread awareness. That also makes women little confident. But one thing is there, that a lot of women think that, okay, well, these celebrities get treated in western countries or say abroad, so they are doing well, but it's not such. So we have all these treatment options available in India also. It's just that for privacy reasons, some celebrities may decide to seek treatment abroad. But in India, breast cancer treatment is very much at the same level as globally. It is at par with global standards. So this is just to reassure women: get diagnosed. It may not be breast cancer. Still try to pick it up early if there is any abnormality. And even if it is breast cancer, you are going to be treated very well as per the global standards, and there is a very, very, very high chance of cure. So do not panic, do not worry, get yourself screened, get yourselves checked.
Right, Dr. Mansi, you have put it in a very, very concise and impactful manner. Coming to, because you talked about anxiety issues, and this is this image of body image, and then of course you seek family support. So do you think what role does counseling play as such when we talk about breast cancer, and how can we ensure that women have that support system that is needed?
So definitely, we really underplay the body image issues and all. So I think counseling goes a long way. We also have tried to reduce the impact of surgeries, where now we have breast conservation surgeries where the woman need not lose her entire breast. Or even if they have to, then there are better reconstruction surgeries done, where the normal breast size is maintained and a woman feels normal, because it goes a long way. Every woman identifies herself with her body. Though I see a lot of brave women not really worrying about how it will look because they want to be in charge of their health, in charge of their families, but counseling helps these women a lot. So we usually have psycho-oncologists support for women who undergo treatment for breast cancer, where a psychologist is available to counsel them from time to time. We also have support groups of breast cancer survivors. I think shared trauma or shared, grief, be it about the loss of breast, that goes a long way, where somebody has gone through the same problem. If they, can speak up to other women, it really helps them. So I have a lot of patients who talk amongst themselves and pull each other up whenever they feel down. So, and I think Indian families also, because the whole family needs to undergo at least one session of counseling, because it will help them understand what the patient is going through much better. And even the caregivers, the family members, need sometimes support system, because it is a long process and they themselves are fighting with their own fears. So counseling should go hand in hand with treatment. I definitely agree with that.
Right, Dr. Mansi. Any other takeaway that you would want to share with the audience, because you've specifically curated this session for awareness creation around, breast health, about preventive lifestyle, better quality of life, or maybe a more, physically active life that, that can add to the overall well-being, anything that you would want.
So I would say, see, the risk factors of breast cancers are modifiable and non-modifiable. We can't do much about the non-modifiable risk factors. So to make up for those risk factors, we try to do breast self-examination and the screening strategies. But that alone is not going to take care in preventing cancers. About 30 to 40% of breast cancers can be prevented in the first place. So, to prevent breast cancer, I would recommend every woman to know about the modifiable risk factors. So, I would say a healthy lifestyle, like you said, a physically active lifestyle is very, very important. 40 to 50 minutes of exercise, 5 days a week is extremely important. Smoking has been strongly linked with breast cancer. We see more and more women smoke these days, but it is much more dangerous in women to smoke than men, because the risk of breast cancer is very, very strongly linked with smoking. Alcohol also, I would say, at least restrict the intake of alcohol, keep it very, very moderate. We don't need to compete in every bad habit also with men. I'm not saying it that we don't need to be at par with men. I'm myself a feminist, but these things really go a long way in your own health management. So avoid smoking completely, restrict the amount of alcohol, have more fruits and fibers in diet, have healthy diet, avoid preservatives. Coming to the gynec health, a lot of women take oral contraceptive pills for long duration. When it is taken, it may increase the risk of breast cancer. So I would recommend women to go and discuss with their gynecologist which oral contraceptive pill will have the minimal hormonal exposure, which will put them at a risk of breast cancer. Postmenopausal women, especially after menopause, try to lose weight, because obesity after in the postmenopausal group is very strongly linked with breast cancer. And in the postmenopausal group, also a lot of women seek hormone replacement therapy for the side effects of menopause. I would not say completely against it, but try to take it in a safe way. Consult a gynecologist, where you can have safer options for hormone replacement after menopause, because again, HRT is known to increase the risk of breast cancer. So these things, and if you plan a pregnancy, try to plan it before the age of 35 years. If you do have a child, try to breastfeed the child with both your breasts for at least 1 year. These are few things which are in our hands. For the rest of the things, at least we get regularly checked through breast self examination and through screening. If we have both of these going hand in hand, prevention as well as early detection, I think breast cancer can be easily beatable by all of us.
Right, Dr. Mansi. Thank you so much for sharing your expertise on this very vital topic. We hope this discussion inspires more and more women to go for self-examination and seek medical intervention in case of any abnormality that they might detect. Also, better diagnostic facilities need to be ensured so that more and more women can get screened. And, like they said, remember, a stitch in time saves nine. And when it comes to breast cancer, I think the earlier it is diagnosed, the better your body responds to the overall treatment. So it's crucial for individuals to be proactive about their breast health and for healthcare systems to improve access to screening and early detection programs. Thank you once again for taking out time from your busy schedule and joining us for this very insightful discussion.
My pleasure. Thank you. Thank you for inviting me. Thank you.
That was all for today. We hope to see you all again tomorrow in another important discussion around breast cancer awareness. Meanwhile, please keep following our social media pages for more health information. See you all soon. Goodbye for now.